Grazie per la presentazione, Francesco, grazie
Thank you
per l'ospitalità.
presentation. Thank you for inviting me and for giving me the opportunity of speaking today. So the topic, it's a topic which is slightly different from what we heard till now, which is the treatment of bigger veins, reticular veins. Now it's a completely different field, ulcers. Laser is not the way to treat ulcers. I want to be clear. We have to treat the patient holistically, globally. We have to start with a diagnosis and then treat the disease which caused the ulcers. And after this, we will treat the local treatment of wounds. And the local treatment is summed up by the TIME acronym. TIME means tissue, infection, moisture, epidermal margin. And for each letter, you have to perform an activity. For example, debridement, remove infected tissues, apply moisture balancing dressings, etc., etc. But for example, you should protect the margins and converge them towards the center of the ulcer. So the laser has different effects on local treatment. So once we have done the preliminary treatment, we get to the local treatment, and the laser can have a couple of effects: debridement effect, a biostimulating effect, so a photodynamic effect. So it stimulates the margin advancement. Let us see the debridement systems. There's a non-surgical effect, which is enzymatic, autolytic, and biological. It is a slow system that is not fit for bigger ulcers that would require weeks, if not months, of treatment. There's a surgical treatment that can be used, a traditional treatment with scissors, curette, scalpels. And then there's a hydrosurgical treatment through a specific equipment which is called VersaJet. So the concept of debridement is very quick and effective because it removes very quickly the superficial part of the ulcer, and the healthy tissue underneath surfaces. And then there's a mechanical system. The wet to dry, it's painful, so it's been abandoned, the NPWT and ultrasounds. And then there's the new kind of physical debridement, which is the laser treatment. How can we choose the method? But this is just a personal criteria. So if we have small ulcers, clearly we cannot use the surgical system. We can use the enzymatic or autolytic system, also the mechanical system with ultrasounds and NPWT, or the laser, which can be done in our studio if the ulcer is not wide, extended. If there are large ulcers, we can use, once again, a mechanical debridement, the laser. If there are very large ulcers, you need some time with the laser. Or the autolytic system can be combined. So if only one treatment is not sufficient, we can use the so-called advanced treatments with autolytic debridement. If we work in a hospital, we need a very quick debridement. We cannot start with the traditional way, so we can use the laser treatment. We can do that under sedation, as Mr. Zini was saying, so the analgesic therapy, or very quickly work on the ulcer with the laser. Which are the specific indications? Ulcers with necrotic component with fibrin, infected ulcers, ulcers with delayed healing, or with a strong inflammatory component or painful. We will see later that laser is extremely effective also on inflammation and on pain. So let's see the effects of laser. So it can give us a very sharp debridement, painless or just slightly painful. Sterilization is a strong term. It balances the infection. It has a biostimulating action and anti-inflammatory and analgesic, as I already said. The debridement and sterilization can be obtained by photocoagulation. It's a so-called surgical effect by laser, which has to be focused laser. Sterilization can be obtained by combining this laser effect with photosensitizing of chromophores. We can obtain this with the focused lasers, but also with defocused laser. And then the biostimulation effect and anti-inflammatory and analgesic effect, which are not surgical effects, but medical effects of the laser. In this case, we will use a defocused laser. Photocoagulation is necessary when we want to have very intense debridement, as the scanners, which can be fractional, as in this case, these are the more modern cases, or rotating. The engineering differences will be explained by Mr. Marangoni, while the technical differences, why one or the other, the one you see below works randomly, changing every time the point which is hit. The rotating scanner one gives more homogeneous images without this randomization of the laser beam. There's something very interesting here. Somehow, it is what we do in aesthetic medicine. So it creates microchannels in the skin through vacuolization and vaporization of the tissue. And since these microchannels cover 30% of each targeted square centimeter, the surrounding tissue or dermis, which is not hit by the laser beam, rebuilds the collagen, which was destroyed by the laser. So there's also a resurfacing effect, biostimulation effect of the deep derma. Clearly, there are softwares that are continuously updated and tell us the area coverage, the percentage, the area of figure, the time and number of micropixels, and also the time on and time off. Let's talk about the wavelength, 808, because it offers two advantages. It is not absorbed by water, as we know, but it is highly absorbed by exogenous chromophores. And this is particularly indicated for this kind of treatment. We can do this with the 1470 as well. 1470 has a high water absorption, and less chromophore absorption, but since chromophore is liquid, the water absorption allows to use also the 1470, even though the wavelength of 808 is preferable. As you know, CO2 lasers with a much higher water absorption have an almost negative effect because you can easily obtain carbonization of the tissue, which is an effect we don't want to obtain. For this purpose, the photothermal effect, high fluencies are needed. And here is what we obtain with the 808 laser. So according to the temperatures that we can reach, we can have several effects on the skin with low temperatures. We can have hyperthermia and photothermolysis. With higher temperatures, we have denaturation and coagulation. At 100 degrees, which is the temperature of the frictional scanner, we have vacuolization and vaporization. And this is the effect of carbonization incandescence, which is easy to use if you are not careful with the laser. But we don't want it because there's the tissue destroyed. And it also doesn't heal, on the contrary, it gets worse. Here you see the photothermal effect of laser debridement. So the effect after 1 week when the chromophore is separated. This is a huge ulcer. This ulcer, this summer, together with Mr. Francesco Zini, we worked on this case together. Where were we? In Santo Domingo. It's a Dominican Republic. It sounds like a paradise, but we were there working. So a patient arrived with this very bad ulcer. We treated her. The huge crust was treated also surgically, but then the laser helped us a lot with a photodynamic effect. I would say not to sterilize, but to kill the bacteria. And chromophores are used to limit and transform the absorption of the laser and sterilize the wound. So chromophores can be different. We can use blue dimethylane, endocyanine can be very useful, and since the methylene blue works very well, we prefer to use it. So when the chromophore is hit, singlet oxygen is produced, which the cytotoxic effect, also having a different action according to the cells that are hit, because bacteria are hit, rapidly growing cells, and weigh less. The cells like fibroblasts, which have a lower reproduction cycle. And after the photodynamic effect, there's a biostimulation effect. And for this, we no longer need those energies. So we need a low-level laser therapy, non-thermal, low fluencies, which should not exceed 20 joule per square centimeter. So laser energy is absorbed by chromophore cell substances. So we talk about endogen, melanin, hemoglobin, In this case, the laser energy is absorbed by these chromophores. As you can see, metabolism is increased, cell metabolism, microcirculation increased, as mitochondrial production. And these effects are also beneficial because they are propagated to the surrounding tissues, and if we treat areas which are not wide extended, we can suppose that the effect will be propagated to neighboring areas. Histologically, it was proven that photobiostimulation increased population of macrophages, lymphocytes, fibroblasts, endothelial cells, keratinocytes, all of them involved in tissue repair. So you can see that all the cell lines that help rebuild the tissue are involved. Which are the final effects, the outcomes? Tissue edema and inflammation are quickly solved. Infection is decreased. This by itself, even if there were not direct effect on the pain, has a non-direct effect on pain, which is also a direct effect because there is a significant inhibition of endorphins and inhibition of prostaglandin and stimulation of endorphins. So we have both a non-direct and a direct effect. We increase the collagen synthesis and healing is much faster. This is the photobiomodulation, biostimulation effect with a defocused laser or with frictional laser. This is after 2 sessions of biostimulation. You see how the base of the ulcer improved sensibly. To draw the conclusions, with laser, we can perform an office-based wound treatment or in the hospital, a surgical block, with the debridement, getting rid of necrotic tissue and fibrin through photocoagulation, infection controlled by photodynamic effect, and biostimulation to speed up the healing process. All with a moderate pain or painless with frictional laser especially, and in the total absence of bleeding. All of these effects are achieved, as I said, without pain or with a very little pain, without anesthesia, and as I already said, in absence of bleeding. And this leads to, so clearly, the time we need to treat an ulcer is longer, but starting from the first sessions, we have a less inflamed and less exuding and painful ulcer with a faster healing rate. Thank you for your attention.